India now are scrambling to contain a rare outbreak of Nipah, a virus spread from animals to humans that causes deadly fever with a high mortality rate. Outbreaks are rare, but Nipah has been listed by the World Health Organization, WHO, alongside Ebola, Zika and COVID-19, as one of several diseases deserving of priority research for their potential to cause a global epidemic. Nipah usually spreads to humans from animals or through contaminated food, but it can also be transmitted directly between people. Fruit bats are the natural carriers of the virus and have been identified as the most likely cause of subsequent outbreaks. Symptoms include intense fever, vomiting, and a respiratory infection, but severe cases can involve seizures and brain inflammation that results in a coma. Patients have a mortality rate of between 40 and 75% depending on the public health response to the virus, the WHO says. The first Nipah outbreak killed more than 100 people in Malaysia. It also spread to Singapore, with 11 cases and 1 death among slaughterhouse workers who came into contact with pigs imported from Malaysia. Bangladesh has borne the brunt in recent years, with more than 100 people dying of Nipah. 2 early outbreaks in India killed more than 50 people before they were brought under control. The southern state of Kerala has recorded 2 deaths from Nipah and 4 other confirmed cases since last month. There are currently no drugs or vaccines specific for Nipah virus infection, although WHO has identified Nipah as a priority disease for the WHO Research and Development Blueprint. Intensive supportive care is recommended to treat severe respiratory and neurologic complications. Flu, COVID-19, and Nipah can all cause fever. But flu and COVID affect the respiratory tract the most, while Nipah targets the brain region. Having first appeared thousands of years ago, zoonoses, diseases that can be transmitted from animals to humans, have multiplied over the past 20 to 30 years. By occupying increasingly large areas of the planet, experts say, humans also contribute to disruption of the ecosystem and increase the likelihood of random virus mutations that are transmissible to humans. Climate change will push many animals to flee their ecosystems for more livable lands, a study published by the scientific journal Nature warned in 2022. According to estimates published in the journal Science in 2018, there are 1.7 million unknown viruses in mammals and birds, 540,000 to 850,000 of them with the capacity to infect humans.